Hello, good afternoon to those of you that's afternoon, and good morning to those of you that it's morning time. We are super excited that you could join us today to really just hear about different updates going on with the LifeCourse Nexus as well as the Charting LifeCourse framework, and really just to share exciting things with you that many of you are involved in, but also opportunities for you to potentially get involved in more things. In our hour together, we will have a fast-paced hour where we're going to share a little bit about the evolution of charting the life course framework and tools, give you some new ideas about the different training opportunities and pathways we've been working on, hear different things happening related to our networks and our organizational affiliates, and hopefully just give you new ideas on how to engage and connect and shape the next decade of the Life Course framework. So, believe it or not, we will be celebrating our 10-year showcase coming up in 2026. And so, we really thought it would be a great time just to kind of do a state of the Nexus and let people know what's going on. For those of you that don't know me, my name is Shelley Reynolds, and I am the director here at the LifeCourse Nexus, and we are housed at the University of Missouri, Kansas City Institute for Human Development. We are Missouri's University Center for Excellence in Developmental Disabilities, but our work expands beyond just developmental disabilities. I come to this conversation not only in my professional role of working alongside self-advocates and families, but also as a sibling to a brother with the developmental disabilities. And many of you that are joining us on the call come to us with your own personal whys or your own professional whys that we do the work. And I hope that really comes out in today's conversation. The other thing that I wanted to share that although I am here kind of being the spokesperson on behalf of the Life Course Nexus, none of this is possible without an amazing team that works both behind the scenes and in front of the scenes. Many of you have engaged with them in different ways, whether it's through our training center or you've attended our showcase, or maybe you were trying to figure out how to get a contract through. None of this is possible without these trainers and team members. And so I wanted to just take a minute to thank them and share that information with all of you about how important they are. I always like to kind of get people, a lot of people will say to me, Shelley, where did the phrase Life Course Nexus come from? And I always like to help people understand that the word nexus is really defined as a central link or connection of two or more things. And that's really what the Life Course Nexus is here to serve you and to connect things together. Our biggest mission is to really create a community of learning, to really bring together. So, how can we make transformational change at every level? The other thing that's really come from this work is it's become a movement, a way of thinking beyond just the way of implementing things into practice. And so, if you're joining us on the call, you are very much a part of this movement to really transform lives for all people. All of us come to this conversation with the core belief that all people have the right to live, love, work, play, and pursue their life aspirations in their community. That's what's connecting us. And what the Life Course Nexus is hoping to do is to continue to bring a structure and provide resources and opportunities to you so you can continue to share this work in everything that you do. As I was preparing for this, I ran into a video that we did 5 years ago. And the video was, I was sharing our commitments as a Life Course Nexus. And it was really interesting that I ran into this yesterday because everything I'm sharing with you continues to really bring to life those commitments. The first commitment that I talked about on that video is how is the work that we're doing always centered around changing people's lives. That's why we do what we do, right? And so, yes, we're going to talk about practice level changes, organizational and policy level changes, but it all comes back to how are we making people's lives better? How are we helping them have the life that they want to have? And so, As many of you know, where did Charting the Life course come from and why was it created? And, it started out in Missouri, but it really accelerated when we had the National Community of Practice on supporting families with the National Association for State Directors for Developmental Disability Services. That's really when this work began to become a movement. And at the core of this work is that Charting the Life course was designed by individuals with developmental disabilities and also designed by their families to really give hope, to share ideas, explore possibilities, set higher expectations, help navigate a future, advocate for a vision, and spending time really problem solving and planning around goals. And so that is really what it's done at all different levels. So every one of you has maybe come to this movement or come to the LifeCourse Nexus at different times over the last, 15 years. But this timeline is really, sort of looking at the evolution of why we had to come up and create the LifeCourse Nexus, this place that you can call and get more information, the place that we can continue learning alongside you and sharing all the many exciting ways things are happening across the country. So as you start looking at this sort of timeline, right, it started out really through helping to think about how to support families and the individuals who are part of that family. And then a number of different things happened across the country, right? The National COP started, the Center for Medicaid Services really started to emphasize person-centered practices within their HCBS settings rule. We partnered with HSRI and some of the other national TA providers on the National Center for Advancing Person-Centered Practices and Systems. And then we were all faced with the pandemic. And the pandemic, gave us some time to kind of think about how do we really get the information out to everybody in different ways. So you'll share some of the things that we developed because of that. Over the last 5 years, though, we've continued to really move this from just the principles and thinking to how are we really going to create transformational change by really using implementation science and really looking at policy development. And I'll be sharing examples with you on the different systems that we've started to work with. And so it was focused initially within the developmental disability community, but now we're working within the foster care system, the early childhood system, the aging and disability system. We're working with employment providers and the school districts. And so you're seeing a lot of really exciting implementation happening across the country. We wanted to do the State of the Nexus because you are what drives where we're heading in the future. And so really sharing with you kind of where are we at now, but really hearing from you over the next 6 months to a year about where do we need to go. As we look back at the last 10 to 15 years, the things that I'm seeing really across the nation and you'll see across the globe is that the China LifeCourse framework and tools create a common language. They create shared values and principles that really unite networks and professionals and all different levels of sort of stakeholders. The other thing that Charting the LifeCourse does is it gives you practical tools to support that day-to-day implementation. The other thing that we're really proud of is watching leaders like you think about the different ways that you can use it inside your programs and your organizations with your teams. But it's also amazing to see how it's driving policies, practice, and system level change at all times. And so that's what I hope you get out of today is really hearing how these different things have really come together and hearing the impact from the individuals that are impacted the most. So many of you know, Charting the LifeCourse started out as guiding principles. I always tell people these are the 3D lenses for how we should view the world, our lives, the practices, the policies. So how are we using those principles and reminded in each of those principles as we think about problem solving, making different levels of change? We also have a core library of planning tools and resources. So how do we really ensure that the tools are getting in the hands of people at all levels? I could use those tools in my own life. I can use those with my families or other people I support, but I can also use those same exact tools to bring my team together or my organization, or if I'm trying to create a whole new policy for a system. So those are all the different ways it can be used as tools. But what we're really excited about is what's happening across the country, where we're really seeing Charting the Life Course really enhance evidence-based practices, whether it's a practice related to transition planning from high school, whether it's helping people with employment services, or whether we're working with aging families who are thinking about planning for the future. We're seeing all different ways that it's enhancing different professionals and practices and programs across the country. As I mentioned, the guiding principles are really that lens for how we look at things. I always tell people that the tools are important. They reinforce the principles, but the principles are key to truly understanding and creating that transformation that you want. It's about recognizing that person within the context of the family, thinking about all people. And you'll see this throughout the different structures and resources and tools that I'm going to share with you. It's about helping the people that are impacted most by organizations and systems really drive that transformational change. At the same time, recognizing the three buckets of needs that people have. How are we using those buckets to identify needs? But how are we using those buckets to connect them to resources so that their needs are being met? We think about this throughout the entire lifespan as we think about our trajectory and thinking about those life experiences. We want to focus on all of the life domains. And what's central to the life course framework is that how do we integrate those supports? So we're not only either relying only on family or only on paid services, but really thinking about integrated supports. So part of today is not only sharing where we're at with the Charting the Life Course, but also some of the changes that have happened over the years that maybe happened behind the scenes or people heard about it in different meetings. If you're with us originally, when we kicked off the principles, we had 8 principles. We had achieving life outcomes as a principle and holistic life domains as a principles. Those a number of years ago have been merged together and have officially been merged together. So wanted to share that with people. The other thing that you'll see is that our icons have become a way to communicate using different icons and symbols. The colors have significant meaning. And over the years, we've really ensured that the colors are meeting our accessibility requirements, whether it's for digital or print accessibility. So that's really important that you're staying up to date with the current principles if you're using those principles in the things that you do. The other thing you'll notice is that that icon on the left is really the icon that goes with the whole Charting the Life Course framework. And so we wanted to move it outside of a principle because it's really representing all of the resources and materials around Charting the Life Course. So as we update our icons, as we update our websites, that requires us to update all of our materials. So on our website, we actually have an infographic of the principles, as well as sort of a list of all of the principles as a narrative. So if you've never seen these resources before, these are available for you on our website. There's a QR code there, but there's also a link in the chat for you. I also forgot to mention that if you have any questions, because this is done as a webinar, you'll need to go into the Q&A and pop a question in there and we can answer it for you. So as I mentioned earlier, we've had these domains for a long time. We worked across the nation, across different states, across different types of individuals and families and professionals to really solidify these different domain areas. And we've always had them pretty broadly. These have been our 6, and they really encompass those quality of life areas. What we've done more recently over the last couple years, and I realize we haven't always shared that, is that we've also been really understanding what are the subdomains that make up each of those domains. Because people said, okay, well, I know globally what this domain is, but help me understand the subdomains. And so we broke those three, there's three subdomains for every domain. And then what you'll see on this document is also the different types of topics or the smaller kind of areas that people might go into those. A lot of you on this call use this for conversations or use the domains for conversations. Some of you on this call use the domains to organize your websites or your resources, or you're even using these domains to organize your planning documents. So I think this is a really, really great document if you're doing any of those things. One, it helps you as a professional just kind of know the different things that you might talk to somebody about around that area. And two, if you're someone developing program or organizational pieces or resources, really going back and looking at this taxonomy and how these things line up is really important. So that is now on our website. And so I encourage any of you guys to download that and take a look at that. And I always tell people that this is also the way we organize our library. So when you see our products, our tools, they're associated with these colors. And they're associated with the domains and those icons. So again, it becomes another way for all of us across the nation or the world to use visuals to really help people have that ease of access and understanding. The other thing is that over the years, different people have made different subdomains that are different colors. So one of the things that we're trying to do right now is to really work with some of our early adopter states and organizations to really figure out how we can get this aligned with the color system and the color scheme, if it makes sense. And also to make sure that the icons being used are always accessible in terms of the new accessibility requirements. So now I want to talk a little bit about the tools and resources. And I know quite a few of you are familiar with the tools. But one of the things that we've really been working on is, I talk about this triangle a lot, and that as we develop tools to really transform at every level, it's thinking about tools at the team level. And so we have Charting the LifeCourse tools. We will always have Charting the LifeCourse tools. But we think it's really important at times that sometimes we focus on a tool very specific for a reason. So if I'm talking to a family and trying to gather their perspective, how can I use family perspective tools with that family? How can I use the tools related to their health and well-being as a caregiver, which is different than just helping them think about their life? I can use the Charting the LifeCourse tools to help them think about their life. So we've started to use these three icons, the person icon, which is really what are different tools and resources for myself. And myself could be anybody, right? It could be someone with a disability, without a disability. It's how am I thinking and problem solving for myself? A set of family resources that are breaking themselves into families helping to share their perspective about a family member. Another set of resources around being a family caregiver and supporting the caregiver needs. And then there's also been requests for how do we plan for our family as a unit, as a whole? And so there's a whole other stream of library of resources that are becoming in the future related to that. As you know, many of you have been using the Charting LifeCourse tools in your professional role. So maybe you've been using them in the classroom or you've been using them during planning meetings. And that's what we want to encourage you to continue to do. And so a lot of times those tools are being used more for formal planning processes. But we also want to make sure that people are really leveraging the tools to build that individual's skill set of learning about using Charting LifeCourse in their own life. So these are our foundational tools. And so the portfolio is all 3 pages, right? It's really the all about me page, the trajectory page, integrated support page. And over the years, we continue to add on this. So this is sort of our foundational tools. And then many of you also realize we also have planning tools and very specific domain tools. But these are the foundational tools that we really use to get people introduced and learn the fundamental aspects about LifeCourse and those foundational tools as well. Some of you have seen these. Some of you have been involved in providing feedback on those, but one of the focus areas is really on how are we elevating life experiences? We think that services and supports are important, but we know that the conversation about life experiences isn't always had. And so these resources were developed. And 15 years ago was the original one, and we call it the Blue Book inside here. And it's a series of questions organized by life stages and life domains that really help people think through those life experiences. Because without those life experiences, it's hard to achieve those life outcomes. And so we, in 2026, hopefully here in the next month, have an updated version of the life experience booklet. We've made the font bigger. We've worked with people across the country to think about what are the questions that are most relevant to begin this conversation. We've organized them around the new life domain, the subdomains that we have. And so we're really excited about the full booklet coming out on press pretty quickly. As soon as that comes out, though, we will be breaking that into these different life stages because a number of you have asked for that. These are currently available on our website. There's nothing wrong with these. We just have another version coming to you. But this allows people to share those resources specific to a life domain. So how I've heard people have used these, for example, is maybe somebody is nearing the age of 18. And so they're sent or somebody shares with them the focus on transition to adulthood, which hits every single life domain, including thinking about alternatives to guardianship or supported decision making. Whereas I've also had people say, I'm getting ready to go do my annual planning meeting. And so I sent to the parents the early childhood focus. So these were questions they can begin thinking about of what are the things that excite them or do they have questions about. So our conversations are not always just focused on paid services. So we're hearing many different ways that people can use these life experiences. The nice part is they're really designed for what I would consider our end users. And so they're designed for an individual or a family to be able to pick up and use on their own. The other thing that happens, and I say behind the scenes, only to mean we can't get stuff on our website fast enough as we're getting it done. And so we have a lot of resources on our website, resources that we develop in partnership with people, resources we do because of different initiatives that are happening. But we're really moving in the direction of creating kits related to different life domains and having a number of different things for people to use and different workshops and job aids and how-tos. And so that is super exciting. These are the ones that we currently have on our website. And so as we're redoing our sort of templates and structures, these too will be updated, but we wanted to leave our current resources up there. We get lots of calls about our supported decision-making kits. They're being used across the country in a lot of different ways. That's a big focus in 2026. I'll share with you in just a minute that health and healthy living has been a very big focus of some of the work that we've been doing. We always continue to work on our employment resources, and so that's another big area. And so lots of different ways we've partnered with you guys to do different things. As we've expanded into other sort of populations, so to speak, we also realized how important that family caregiver well-being is. And so we partnered with the National Managed Care Organization to develop family caregiver toolkit resources. again, can be picked up by that caregiver, but our long-term goal is that we would have more workshops around these, more job aids and how-tos on how to use those, and really put a kit together so that people that are interested in using these with other caregivers have the resources and tools to use these in an effective way. This has been a really exciting project that we have done with our national partners at Family Voices, and Got Transition and Span. And so over the course of the last 3 years, we have identified youth with disabilities and special health care need who have worked very closely with us to develop these toolkits that are targeted to the youth, to help them think about what does moving from pediatric care to adult healthcare look like? What are the things that I need to think about? What are the questions I need to have? How do I have successful healthcare visits? How do I start taking initiative and control over my day-to-day routine? What are the different doctors' names and specialty names? And so we're really excited about these kits. They are on our website. They're also on the National Center for Transition to Adult Healthcare for Youth with Disabilities website, which is funded by the Administration for Community Living. So we're very excited about these and where these are going. And so those are available for people to access. But they're just one of the many things that we continue to do around healthcare. We've been having lots of conversations on how the healthcare tools can be used with community health workers, how they can be used in medical settings. And so there's lots of different directions we can go in the healthcare arena. The other thing we have an amazing creatives and communication team. We've been really building up the skills in our team, not only to meet the federal requirements, but to exceed the federal requirements as it relates to accessibility. And so we run everything through the accessibility checks, but we also make sure that the screen readers can read it. It's reading in the appropriate order of reading the document, that everything has that alt text that's needed, that font and text size is the size that it needs to, or that we have other versions if there's not ways that we can make this completely as exceeding accessibility as we hope. This is very important to us. It's very important that we all can get better at this. And so you guys are our community, right? You are our movement. And so as you run across different things, give us feedback. That's the only way that we can make things better. We are very open to that feedback and working with you guys. The other thing that is really important to us is that how do we not only ensure that we are reaching individuals who speak other languages, but that the tools themselves are trans-created to have meaning within those cultures. And so this is just examples of the different ways that we have partnered around trans creation. So you'll see the image on the right-hand side. That is our integrated support star. But when we were working with the Lakota tribe, the star had a lot of meaning to them. And so we really helped to break that star down in a way that would speak to their culture. You'll see on the left-hand side, we were working with a group out of the state of Washington and partnering with the ARC of Snohomish County to how do we talk about housing for families within the Russian culture who think very differently about housing and independence. And so not only did we need to make sure that it was translated into Russian, but that it really spoke to that culture and the way they think about housing. You'll see in the middle there is that for the last 4 or 5 months, we've been working really closely with a group of about 50 people in Korea to really translate everything into Korea and really come up with 50 really strong ambassadors and champions for Charting the LifeCourse. And so the tools have been translated into Korean, and the ambassador series and our fundamentals have been simultaneously translated as we've been working with that group of champions. And after we go through that process, we will then continue to transcreate them to really align with their culture. So we're very excited about this. And, I just want to share with people that this is only made possible by people calling us saying, do you have this language? We really need this. How can we partner to get this done? So sometimes we're able to, we can format them and do all those different things. But a lot of times when people are asking us to translate or transcreate, they are representatives of the communities that they want. And so they partner by bringing that skill set to the table or helping to identify that. So the partnership is what makes these things possible. We don't just have a pot of funds there to translate everything. We wish we did, but it's again working with you guys as in partnership to meet the needs that you guys have and to meet the communities that you're working with. This is another example of partnering with us. We have what's called a development partnership. And so organizations will come to us and they'll say, I really, really want to do something on online safety, for example. So we partnered with the Missouri Assistive Technology Project, who was funded by our Missouri Developmental Disabilities Council to create these resources. But we organized them in a way that they will just be added to the larger library for other people to be able to access. The Life Vision tool, we partnered with the Right Ahead, who has a film called The Right Ahead that really teaches about all the possibilities in life. And that film has educational resources and tools for after somebody views the film. And so we partnered to make sure that our tool was really aligned with that and was a really great partnership. We partnered with the National Arch Respite to develop respite materials. They are the content experts in respite. They are who I go to when I have questions about respite best practices. So how do we partner with them to make sure that we're meeting those national standards, but also getting it out to their network and really working with them on development? So as all of you come up with different ideas, projects, or resources or needs that you have, there are ways to really partner with us on all of that. The team's really working hard behind the scenes because not only are we trying to ensure things are accessible, we're trying to move away from us just, for the first probably 5, 6, 7 years, people were just asking for different tools and we were just cranking out tools just as fast as we can. So there's a whole team, a product development team now that is putting a lot of thought into why are we developing that tool? A tool shouldn't be a standalone. There should always be a tip sheet on how to use it. And if a professional is going to use it, is there a job aid that really helps them be able to put it into practice? More importantly, is there maybe a training workshop on those things? And so we're going through the many different tools and saying what's existing out there that doesn't really give people the guidance that they need to use it. It's funny. It's like sometimes I look back and I'm like, how did we get to where we are? Because as the Nexus team continues to grow, they're like, why are things the way that they are? And I will tell you, the LifeCourse Nexus website was really just designed to be this place that our early adopters would go and get some of the stuff that we talked about in different meetings. And then all of a sudden it became a website where people are like, well, I need this resource and I need to be able to register for training. And how do I find out about this? And so we've really had to continue to evolve and continuously evolve to what does a library look like? What are the kits that should be available publicly? What are the kits that really need training associated with them so we can start hosting workshops around those specific tools? How are we also making sure that our resources that are designed for an individual or their family, that they have access to those and they're not overwhelmed by all the other things? And so those are the many different things that we're balancing as we're trying to figure out how to continue to meet your needs and your demands. The other thing is around training and learning opportunities. And if you go back historically, and you look at how Charting the Life Course started to really be shared and scaled, you know, a lot of it started with our community of practice on supporting family states. Those were 6 states that now have evolved into 23 states. Those states have adopted Charting the Life Course to serve as their principles for the initiative on supporting families. And so if you kind of like think pre-COVID, or even, when we were doing this for the first, I would say 5 to 10 years, we would host what we would call a Charting the Life Course community-wide event. We had every stakeholder in the room. It didn't matter whether you were a person with a disability, a family member, a professional, representing any sort of system. And we would just have these interactive activities, and there was 2 or 3 of us, and we would go around the country and we would share that information. Again, Life Course was never, ever, we never realized it was going to be what it is today. The next thing that happened was, and it really started out in DC, because one of our really close partners and colleagues said to us, wow, you've shared a series around the principles with your community of practice, but I want that for all of our No Wrong Door and our Aging Disability Resource Center staff. Will you have a virtual ambassador series? And so we created an ambassador series to meet this need that somebody had. And then COVID hit. And a lot of different people kept saying, we really want that Charting Life Course Ambassador series because we really like Life Course. We're really interested in it, but we want to learn more about it. And so we continue to open up more and more series. We have open series, we have organizational series. States often purchase series for different reasons. And so when we host those series, we were able to really focus them on the context of why somebody ordered that series. So maybe they ordered that series because they were redoing their person-centered plan. So the working committee wanted to go through the series, or maybe people wanted it because they wanted their family navigators to go through it. And so there were lots of different reasons why people were taking the ambassador series. And so we used that as really the place to teach people more. And it was more about the principles. Again, it was really focused on you're an ambassador of the principles. You aren't necessarily an ambassador of Charting Life Course practices. You really have a deeper understanding of the application of those principles. So we had to really think about training pathways. The other thing we had to really think about is getting really, really intentional about what the training workshops are for, who they're designed for, what are the learning objectives, and what is it we're really trying to get at. And so lots of the Charting the Life Course workshops and series, anybody can take them. However, we have specific pathways now so that if I am a person with a disability and I'm just wanting to learn Charting the Life Course for my own life, I'm able to do that. If I'm a professional and I want to be on a professional pathway, we have a more written out professional pathway to really help people get to the training and learning that is where they're at and what they want to do. So the first set of training workshops that we have been piloting over this last year, and we've been piloting them with all of you guys for the last couple years, but we have launched a new curriculum called Exploring My Life Course. This is designed, it's developed to be using universal learning practices, but it also has the ability to have cognitive accessibility activities. And so Exploring My Life Course is used to help anybody really think about their own lives and to not only learn about the tools and the framework, but really with the objective of developing their plan and figuring out what they want to do. And so this is just an example of some of the very interactive activities that we've put into these. And so we've broken it out. Some people have asked for it to be all day. I think that's too long. Some people have asked it to be broken into different things. And so the team has been going out and piloting this with adults with disabilities, but we know it can work across many different populations and ages. And so those activities really make it interactive. It's sort of gamified it in a way that the whole day is really kind of thinking about things. We've got images you see on the right-hand side. We have these different cards for these different small group activities. And more importantly, it's after I've been through here, how am I going to share it? Who am I sharing this information with? And, just some of the quotes from there have been amazing. When the team gets back, they're both amazing to me and sad to me because why I say they're sad is because it tells me that we don't take the time to really listen to what people want in their lives. One of the individuals, after doing this, they were like, he loves to cook. He could talk about his recipes. He could talk about different ways that he would cook that his mom cooks that he doesn't like. And so that throughout that conversation, someone said, "Have you ever thought about being a chef?" And he said, "You mean I could be a chef?" And so it's really about really understanding a person, their life experiences, and what they want to do. Another individual said, "Thank you for teaching us that we can do things we didn't think we could do." And that's really what we're getting at with LifeCourse. That's really exciting. So over the course of the next year, you're going to see more and more different resources that are really lessons designed for that individual to learn the skill sets themselves and to really explore who they are. We also have been having conversations with a lot of you, probably on this call, who have also been doing these things. There's a group out of Ohio who has developed a bunch of cards and a bunch of like a game board for people who are in grade school to use. And so we're hoping to really feature all of these things at our showcase to show you all of the different ways to make it interactive at the person level. Now I'm going to move to the professional level, the professional pathway. When I say the word professional, what I mean by the phrase professional is professionals inclusive of direct support professionals, of leadership, family navigators, peer specialists, self-advocates who are trainers. So it's people who are doing things beyond using the life course in their own lives. They're using it with others. They're using it for some, they're either using it for peer support or for planning or they're training others on that. That was one of the things that we ran into is that we started to recognize that a lot of people only wanted to learn about LifeCourse for their own lives, and they were really being pushed down the professional pathway because that was all we had available. And so how are we getting the right people on the right pathways for what they want? And so this saying professional does not exclude a person with a disability who is doing professional roles or skills. It does not exclude a family member who is also in a professional role of maybe family peer support or family navigation. And so we continue to have in-person events. We also continue to have an hour-long overview. And so there's lots of different ways people are just kind of almost exposed to it, have just a exposure, overview, understanding. What is brand new that we never had before is what we call our Charting the LifeCourse Fundamentals training. And what we realized with the ambassador series, there were a lot of people that were in that ambassador series, but what they really wanted was a deeper understanding of the tools, how to apply it to themselves and potentially how to apply it to others before they had the ambassador series. So we now have and have launched the Charting LifeCourse Fundamentals workshops. And we've had over 450 people attend those with a lot of success as a really great launching part. A lot of professionals feel like that's what they need to get started, and then they're able to really integrate it into practice. Some people want to go further and continue to further their understanding of the principles and application, so they go to the ambassador series. And so you'll start seeing we're going to continue to add things on that learning pathway line because that's what you guys are asking for. The other thing is that box on the bottom is a lot of you have said, can we be taught how to use this tool? Or I want to get better at using this tool for planning or planning around a specific domain or a specific purpose. And so we want to start offering sort of one-off workshops where you can deepen your skills around a topic, use of a tool, or learning about a specific topic by itself. And so our vision is to have a big catalog of those workshops that could either be self-paced, they can be hosted live, or they can even be watched and archived. The other thing that you'll see is that a lot of you that are ambassadors have asked to kind of go on for further development, whether it's meeting badge, the presenter's badge, we're working on a trainer's certificate for fundamentals. And so in order to access those more sort of certification, sort of badging, credentialing, an ambassador's is the prerequisite for that. So we're continuing to identify how to help people gain those skills to be implementers and trainers in that arena. So this is a little bit about the fundamentals training. I encourage anybody that went through Ambassador Series anytime within the last further back than 2 or 3 years ago, that the fundamentals is a really, really great refresher course. A number of you have asked us what comes after ambassadors, and we will be sending out emails to all the ambassadors saying, if you haven't gone through it, please go through this refresher course. It will really help you as you really move into the new sort of way that we're implementing Charting the LifeCourse into practice. The other thing that we're super excited about, we have a bilingual team member who now hosts fundamentals and ambassador series all in Spanish. And so the materials are all in Spanish. The entire conversation and dialogue is in Spanish, and we're really excited about that. We've had a couple organizations contact us because they want us to host it at different times or for their organizations, and we can do that at any given time. So that's really exciting as well. We hope to continue partnering with all of you to continue offering them in other languages as we build the capacity of the Nexus and also of you guys to share them with all types of communities. I also think it's really exciting. There are 3,544 ambassadors worldwide. I add the worldwide because we obviously have a big group of ambassadors in Korea and Canada, Australia. We have Singapore. So we are getting more and more. We have more and more people across the world calling us and asking us about LifeCourse. I think it's super exciting just to see the numbers in the different states and to really not only see the numbers of professionals who are trained as ambassadors, but then to also hear about the work that they were doing with that. Most importantly is the impact that the training is having. So from the individuals, I can do more than what I'm doing without depending on others. That's a powerful statement when you're done with exploring my curriculum. Hearing parents talk about, trying to create a picture of their child's life using the different tools and preparing for the future. Professionals talking about how they have a clearer perspective of a person's life, right? Not only that they can focus on what's visible now, but also focusing on the current and the future. I thought this quote was really powerful too. When somebody from Korea emailed us and told us, I was reminded once again that the moment planning begins, each person becomes the owner of their own life. I believe the portfolio will be a useful tool for helping everyone become the owner of their life. And that's ultimately what we're trying to accomplish. The other thing that I wanted to share with you is that we're really working at an organizational and systems change level. There's a lot of words on this, but when we work with an organization, when they contact us and want to become an affiliate of ours, we really work with them and say, what level are we trying to change? Are we changing your front door? Are we changing every level of your organization, including aligning your policies and your culture? Are we just trying to train your staff on a specific practice? Because what we know is that if I just train you if I just train a group of staff who don't have that support of their whole culture, it's really hard to make the level of change that they want to change. And so we really work with organizations. We have over 100 organizations that have come to us, including 17 state systems that said, what does LifeCourse look like integrated at every level of our organization? If we align our policies, if we train our staff, if we align our procedures and our planning requirements and our tools, what does this look like? How do we also make sure that we are really targeting the individual and their family? I think the thing that we really work hard on, and sometimes is very frustrating for people that contact us, is that they say, I just want training, one and done training. And we'll do it. We don't like to do that. What we really believe in is using implementation science and really building the capacity, not only of people to be able to share and train on LifeCourse, but more importantly, how are you integrating this into an organization or a program? And so that it can be sustained and scaled, so that it can be done with fidelity. Oftentimes I'll hear like, well, the staff aren't using it the right way, or, well, that's because it's not being done with the coaching and mentoring and the fidelity that is needed. So we at the Nexus really want to work with organizations and programs using implementation science phases so that you are building that capacity for that long-term sustainability and scaling. We have a number of organizations who have worked through all those processes with us, and we are starting to identify them as our distinguished affiliates. And so at the showcase, we will be announcing some of our first distinguished affiliates across some of our practice areas. The other thing is there is different pathways within the professional pathway that we're working on. So your frontline staff, those that are using the tools on a day-to-day basis, what should they be trained on? How should they learn about LifeCourse? But more importantly is that pink area. How are we training people who what I call implementers, program managers, supervisors, quality assurance, organizational leadership? That's when the real organization and systems change happens, is when those individuals start using the lens for everything that they do and to support those day-to-day practitioners and what they're doing. We also really focus on that leadership at that organizational level. Without the leadership using this as a lens for their strategic thinking and the way that they're financing things and organizing their structure, it really creates a really strong level of change at every level. The other thing that's super exciting is all of the different places this is going. So not only are we seeing individual professionals contact us or go to our open series of our training on our website, we're having organizations call us and say, how can you help us improve our peer specialist program? How can you help us improve our post-secondary inclusive college program? How can we improve our respite program? And so when we start talking about programs and practice areas, we can really, really look at how are we improving the professionals to use the LifeCourse? Why are they using it? Are we doing it because we want better plans and a better conversation, which is a nice outcome? But some people are also wanting to do it because they want the individual to learn the skills. So schools might be using Charting the LifeCourse to enhance self-determination or self-led IEPs. We're working with youth, some youth specialists, so that they're using it with youth in the foster care system who are transitioning out of the foster care system. So there's lots of different ways that it's being used across the country. But the more and more we get to identify these practices, the more we can create the evidence to really support these as best practices across the nation. We will have fidelity scales. We will have ways to really think about building the capacity of professionals. The other thing I want to share with you is, for many years we've had these different structures, but over the course of 2026, we will continue to really solidify these structures. Those over 100 organizations that have contacted us have made a commitment to integrating LifeCourse at a program level or an organizational wide level. We have a lot of state systems, many that started with the community of practice, but many beyond just the community of practice, who are using it to enhance their person-centered practices and meet different requirements. So what does it look like to be an affiliate? What does it look like to be a distinguished affiliate? And how can we help organizations learn about LifeCourse, launch LifeCourse, but more importantly, scale and sustain LifeCourse? And that's what we're committed to doing. So those organizations, by being an affiliate, will have different opportunities for different conversations, different learning and training opportunities, and different opportunities for their staff. So we'll be sharing more about that at our showcase. I've already shared with you that people can come to us to partner to develop things that will be on that broader public-facing library, so you can become a development partner. We also continue to work with organizations. A number of organizations have talked to us about what would it mean to be a center on excellence in Charting the LifeCourse. Well, what it would mean is you would help us with training, you would help us with research, you would help us with development. So we're continuing to figure out ways to expand the research. We also have a number of states and organizations who really want to create a network or a chapter within their state. So Ohio, Minnesota, Missouri, Kansas, Pennsylvania, I've probably missed some others, are saying, how do we sustain this work across systems, across regions in our states, across populations, and across every level? And so we have different structures and ways for supporting that work and helping really launch that and continue that sustainability. We're nearing the end of the time, so I wanted to share with you different ways to stay connected to our work. Again, I started this out with saying that this is part of a movement and that the Nexus is here to really intersect and connect with you for that transformation, that learning and sharing. So there's many ways that we're trying to do that. Our biggest event is our showcase that we have in Kansas City. I would really encourage you to, if you're new to LifeCourse or if you've been doing it for a really long time, we're really trying to organize our different sections related to different practice areas. So foster care, developmental disabilities, aging and disabilities, but also really looking at the different professionals that are using that and make sure that there's something for everybody who attends that. Early registration is open till December 31st, and we will be letting people know. We had a huge list of different people who applied for our breakout sessions, and so next week we'll be sending out those emails about that. But it's a place to really come and learn and share. We've extended, people requested every year for us to extend a couple more hours on that second day for another breakout. So we have done that as well. So if you have any questions about that, let us know. We're really excited about that. There will be a team of 11 people from the Korean Charting the LifeCourse Ambassadors Group come over here, and I'm really hoping that they can meet up with you guys and learn from all of you. This is brand new. We have had intensives at our showcase before. Our first intensive that we had last year, and we will have it every year, is if you've never been through fundamentals, we offer fundamentals the day before the actual event. It's during the day, and then that evening we have our ambassadors event. And so it's a really great opportunity for either a refresher or a first-time person to go through it. This I'm really very excited about is that we are having an all-day intensive because we've been working with so many organizations and state systems over the last 5-6 years to really use Charting the LifeCourse for that organizational change. What I mean by organizational change is, what does it look like for quality improvement? What's it look like for training? What do plans look like if I integrate LifeCourse? What does the planning process look like? What are things within our regulations and our guidelines as this meeting are helping us to develop? And what is the overall organizational culture? And so this is an intensive day for people who are administrators, leaders, supervisors, project managers, who are interested in all of the different examples and ways that people have used Charting the LifeCourse to enhance every level of an organization. So we will be sharing with you their examples, their resources that they've done, and all the many ways they've implemented into those things. So I really encourage anybody that's doing it at a program implementation or a systems level implementation that this is a really great intensive for you to share, to attend. The other thing I'm going to share with you is that there are ways that you can get information about LifeCourse anytime. There's a podcast that's both on YouTube and Spotify where I don't know if it's every month or every other month. I should remember that. There's really awesome interviews with people using Charting the LifeCourse in either their own lives or in the organizational change that they're doing. So we just did an awesome with a group from Pennsylvania who are using it in the voc rehab system and the systems level work that they're doing. We've focused on family networks on another one. So there's a ton of really great topics. So I encourage you to check out our podcast. If you are not already receiving our Nexus newsletter, this is something we kicked off in 2025 as well. We highlight different tools that we're working on and things that we're updating. So get signed up for that. All of this information will be on an email. We will email out to you guys when this is over. We're on all the socials. So if you're not friends with us or liked us yet, please like us on Facebook. Check us out on LifeCourse Nexus and check out the Showcase YouTube channel as well. Showcase 365. So as you know, we like to focus on the person in the context of their family, focusing on all of their quality of life domains, really thinking about their 3 buckets of needs, while we're also ensuring integrated supports across that entire lifespan while focusing on life experiences. We hope you learned a lot today. We are so grateful that you joined us. You know that you can call or email me or anybody on the Nexus team because we want to be here for you. We want to support you so you can continue to share and sustain this work across the nation. So thank you, everybody, for your time.